I'm really excited to welcome to the show somebody whose work I admire greatly because I've been reading up on what it is you do, and you deal with something that is so important to this audience, and we're going to share it with them in just a second. Let me welcome Dr. Scott Gabbard from the Cleveland Clinic to the Brett Winterble Show. How are you?
Brett, thank you for having me today.
It's great.
Really happy to be here and talk about something that's near and dear to my heart, and I know very important to a lot of the listeners, which is acid reflux disease. The medicines work very well, but the main class of medicines used to treat this disorder are called proton pump inhibitors. They've been around for about 30 years, and in general, they're safe. The problem is that more and more studies are coming out with potential side effects. There's been shown an association with kidney disease, an association with dementia, an association with bone loss. While they don't maybe directly cause this, there's association, a lot of unanswered questions. So we're always looking for treatments that aren't medicine. And
so we're looking at a problem that affects, if not every single person, everybody knows somebody that this affects.
Absolutely.
I know I've dealt with it in my own family. My wife deals with it and has had this problem. And look, it can be a miserable experience, but then you add to that the economic impact and the cost, $60 billion. That is an unbelievable number to people.
Absolutely. Absolutely. So one of the things that us in gastroenterology speak a lot about are lifestyle changes and non-medical treatments for reflux disease. And that brings us to a company in San Diego that I actually met now 2.5 years ago, that makes a device that helps put you in the proper position while you sleep to decrease reflux.
Now, I'm glad you bring that up, and I'm excited to be talking about MedCline because of what they've been able to do here. Most people, at least in my experience, you stack the pillows, right? You put the arm, the pillow, the whole thing underneath you, and you elevate the head. But it turns out, and I know Dr. Scott Gabbard from the Cleveland Clinic here, I know you've got a lot of expertise in this area. You got a lot of passion, and that doesn't work. I can't just stack a bunch of pillows behind my head and get the relief. MedCline is taking it in a completely different direction.
Absolutely. Now, Brett, stacking pillows works for 5 minutes.
Yeah.
And then they fall down. You turn out of them. They work for a couple minutes. So this company here in San Diego, Amenity Health, developed a product called the MedCline. What it is it's a specialized wedge, incline wedge positioner with a body pillow, and it's designed specifically to keep you on your left side at an incline at night. And what that does is that basically means that anything in the stomach, acid and food that you ate, falls down by gravity, and it doesn't come back up into the esophagus.
So what I'm visualizing then, and I'm visualizing the old approach, right, of stacking the pillows, you're just lifting the head. Everything is still going to be coming up to that choke point, for lack of a better word, where you end up choking in the middle of the night. The MedCline is amazing because it's a wedge that elevates not just your head, but your upper part of your body so that that acid's then fighting gravity. It's not going to happen.
It doesn't come up, and if a little bit does come up, again, you have gravity that pulls it right back down into the stomach. We did studies at the Cleveland Clinic where we took patients who were suffering from heartburn, regurgitation, and even coughing, clearing of the throat at night. That persisted despite being on medicines and taking medicines once or twice per day. These are really tough patients to deal with. We found once they started using the MedCline, their symptoms decreased by 75%, which is unheard of. These are the toughest patients we have, and their symptoms decreased by 75%. We're very, very excited. And we went from doing a study on patients with heartburn and regurgitation. Then I went to my colleagues in the ear, nose, and throat world. We started doing cough and burning in the throat or clearing the throat, helped by 75%. I then went to my OB and gynecology colleagues. We studied pregnant women. Same thing. In pregnancy, it helped by 75%. So this has been just really almost a magical device.
And I'm not hearing the magical phrase there, side effects. There's no side effects because you're not putting it. What is proton torpedo? What was the term?
No, absolutely. I mean, this is one thing that's huge, and really, as a gastroenterologist, again, a lot of my patients are asking me about side effects because they're hearing about these studies in the news of side effects. And there's a huge push to get patients off of these medicines. If you're going to be on a medicine lifelong, you worry a little bit. Again, there's none of those long-term side effects with this device. It works amazingly well. We've been really happy.
And the beauty of the MedCline, and I've got personal experience with it, my wife uses it, is the fact that you are able to use it till you get the relief, and then you don't necessarily have to stay on it all night. You do it till you get the relief you need, and then you're able to function without any of those side effects. It is remarkable. All right, Dr. Scott Gabbard with the Cleveland Clinic. Listen, the MedCline is an amazing invention, and I've personally seen the relief that my wife has received. You have seen it in a number of your patients in your studies. Let me give you a closing thought on this. This is by far a revolutionary pathway forward. And it's something I think most people ought to be exploring if they're suffering from GERD.
Absolutely. I think now in the medical field, we're trying to maximize lifestyle and non-medical treatment for reflux disease. So if you have, if your listeners or if I have a patient who has nighttime symptoms, on a regular basis, I think this is a no-brainer. It's a really good device. It works much better than a lot of the other inclines that I have had my patients try. They always complain about falling down from an incline. This, the way that the MedCline is built, it keeps your body in that optimal position. So this for me has been an absolute home run. It's made my job as a physician much easier because I take very difficult patients that are sent to me from all over the country, and I prescribe them the MedCline, and they're just unbelievably happy.